The NHS goes through millions of disposable gloves every day. At the peak of this COVID pandemic, there was never enough.
We're working day and night to expand that supply base. We're in direct talks with the factories that actually produce the PPE.
Factories in Malaysia are the main source, factories where there have been multiple reports of labour abuses.
Those gloves were ending up in the UK being used by our UK NHS.
So slave labour was in the supply chain to the UK.
That's what the evidence and the reporting for many years has suggested.
That's why we are here to get more gloves from the second largest glove manufacturer in the world. Ladies and gentlemen, welcome to Supermax.
And yet, this billion-pound company has long been accused of making its multi-million-pound profits off the back of labour abuses in its 3 Malaysian factories. Its UK subsidiary, Supermax Healthcare Limited, has been a major supplier to the UK government for years. One recent NHS contract was for £8 million. Evidence of how workers were treated in the past by Supermax in Malaysia has emerged in court papers seen by Channel 4 News. We spoke to one former migrant employee in Kathmandu.
कामदारलाई एकदम अपमान गरेको भन्नुपर्छ यसलाई तपाईको किनकि आफूले कहिलेकाहीँ बिरामी हुँदा पनि रुममा बस्न नि पाएन आफूले चाहेको खाना पनि खान पाएन उले अनि तपाईको बाहिरबाट ल्याउने कुनै कुराहरु पनि एकदम कति मानिसहरुको कपडाहरु सबै खोलेर चेक गर्ने सिस्टम.
Many of Supermax's migrant labour force are not as brave. Their hardships have been relayed through this workers' rights activist. His evidence will turn out to be crucial.
Management abuse them, they get punishment also locked up inside the small room in the factory.
He also gathered evidence and testimony from more than 100 workers, alleging cramped living quarters, forced overtime and excessive recruitment fees, leaving them in debt and trapped in their jobs. And then there are the videos of what workers describe as intimidating searches on arrival. This formed part of the evidence supplied to US Customs last year.
Supermax Corp's share price took a substantial hit today after it was reported.
Their investigation found Supermax had failed 10 out of the 11 indicators for forced labour. The result, an outright US import ban on the company's products. And yet, a month later, the Department of Health here placed Supermax on its list of preferred bidders. It was a decision that would end up testing in court the government's commitment to anti-slavery. Tonight, Channel 4 News can reveal that the government has been exposed in failing to adequately check for slave labour in its supply chains. This landmark case has forced the Department of Health and Social Care to draw up new contracts with companies to guarantee higher standards. The lawyer who brought the challenge believes this was a case where the government's duty to investigate was woefully inadequate.
There was only one phone call that happened.
Just one phone call?
Just one phone call with a follow-up email with questions raised, and there was no response to that email until afterwards. The due diligence by law is supposed to be carried out before you make the decision to allow the preferred supplier on the list.
That didn't happen.
That didn't happen. That didn't happen here.
The US ban on Supermax was hardly a trade secret. The issue had been raised in Parliament, and just days before the decision on the company, the UK Anti-Slavery Commission wrote to officials at the Health Department highlighting the American action and saying,
I am seeking reassurance that your department is taking adequate measures to stop goods that are made from forced labour and subject to international import bans from entering your department's supply chains.
A senior health official replied 5 months later, with Supermax still on the preferred list, saying, to date, there have been no substantiated allegations of modern slavery in relation to a departmental supplier.
So this isn't a marginal case, this was a really serious case. And what's horrified me more recently is to discover that after the ban, knowing what had happened, knowing that the Americans had been investigating the case, had found 10 out of 11 indicators to be present, we still decided it was okay to put them on a framework.
How do you feel about the way the government has behaved in this case?
I feel it's outrageous in contrast to the fanfare of the Modern Slavery Act and their commitment, their outward commitment to modern slavery, that they are not following their own laws that they've created to ensure that there's not modern slavery in their supply chain.
Supermax declined to comment on the case, but the company has accelerated efforts to improve standards to try to get the US ban lifted, including more spacious dormitories, improved medical facilities, compensation for recruitment fees and other measures. They're rewards for the activist whose testimony and evidence gathering has brought this about.
I hope it will be better condition for all the migrant workers in Supermax for the long time.
The Department of Health and Social Care, through their buyers, NHS supply chain, settled the case without admitting any legal liability. They said there were no new orders after Supermax became an approved supplier last November, and insist that wouldn't have happened without an independent audit. They go on to say the new regime will be much tougher and presumably then less risk British taxpayers' money goes on funding slavery or forced labour.